Just as you're an expert, he is also an expert. He's a medical practitioner. Definitely, they would have actually done all of that, knowing full well that they have their health experts, field health educators, and people who go around. So, on that basis, don't you think that we're talking from an authority point of view?
Have they gone round?
Do you have, or do you know any case that, well...
No. What I mean is, have they actually gone from house to house? Have they actually gotten a representative sample of Nigerians and just randomly gone to their homes to test them?
Did you also hear from them that there wasn't an outbreak, what you would call an outbreak of Ebola in the country, and it was an imported case, and every case that we had was linked to the index case? And if they say all of that has been handled, don't you think that we should give them the...
I think that's fine. I think what we can say whatever we want officially, but if that is not given...
It doesn't look like whatever we want. We're talking about some facts. Someone brought it in, and everyone who had primary or secondary contact with the individual had Ebola. And all of those people have been checked, observed, and now they say the very last case, well, is free. So don't you think on that premise, we can't say Nigeria had an outbreak of Ebola?
I think that we can say that. My perspective is to look at both sides of the discussion. So yes, we can say that we have actually identified everyone who's had primary or secondary contact with the index case. And we have ensured that all of them, as at today, are either Ebola-free or, unfortunately, have gone to the great beyond. However, how do we know that we have found everyone? This is the perspective of parents, a lot of parents. And this is the perspective, I think, that the NUT, the teachers who are going into schools, these are the fears that they have. So what I'm doing is just highlighting both sides of the discussion. And this is why we have this heated conversation, because people are saying to themselves, are we sure? Yes, we do have official figures, and we must go with whatever the official declaration is. But to what extent does that help teachers and parents to receive as much comfort as they need to be able to send their children to school or teach in the schools?
But do you think
this is the issue.
Do you think that they've also factored in the fact that they can't plan based on cases that have not been reported? And so if government is planning based on the cases that have been reported, anybody else will do well to report any case whatsoever that you see. So by that, maybe government is trying to prevent them from just perhaps rightly or wrongly feeding into a paranoia.
Absolutely. Unfortunately, I can't speak for government per se, but I think that's a very sensible, perspective that you've put forward. I think that ultimately we cannot continue to shut our schools down indefinitely. My personal perspective would be, let's go to school, but let's make sure that there is a measure of protection, even if all we do is to provide thermometers and train people on how to use contactless thermometers, so that right from the gates of the schools, we can ask people to go back home. Sorry that perhaps it's malaria and not actually Ebola, but we can't take that risk. Even if that's all we do, then I think that would really help.
So are we really realistically looking at a situation where when children are resuming, they're lined up or queued up at the gate and we're testing each one of them one after the other?
I promise you that's what a lot of private schools will do on Monday. Yes.
But is that realistic? Is it sustainable?
I think because some people might classify this as an emergency, yes, it is. The health has to come first. Health comes before education. So because if you're dead, you can't go to school.
Maybe the first few days, that could happen for the first few days, and then maybe they get back to...
That's what I'm looking at.
But that's where monitoring comes in. That's the role of the government, to ensure that this is done consistently. If it's not done, the flip side is we all stay at home. No school, stay at home.
Are we looking at man hours lost? Because I do not think that, each teacher for every class is going to be at the gate carrying a thermometer. I assume that perhaps maybe each school has about 3 or maximum 4, thereabout. I don't know how many they have, but I don't see them purchasing, thermometers or, contactless scanners for every single teacher. Maybe some teachers will have it and then scan the children. Are we looking at man hours?
I think, again, you're raising a very important point. And I guess for teachers who actually are at the fore of this, it's between that and not teaching at all. That could just be the deciding factor. It's either we take measures to protect ourselves or we don't go at all. That's what I'm hearing from a lot of teachers.
All right, let me take you back to the point you made earlier on about autonomy, decentralization of certain things. Does that in any way affect the standard of education? For instance, if they were to maybe decentralize and ask those other schools to provide things as basic as sanitizers, how does that, can it ever be connected with improving standards?
I think that the fundamental, no, I don't think, I know that the fundamental difference between public and private schools is autonomy. The decision, the ability to make decisions at the school level versus the ability or inability to make decisions at the school level, period. That is the one fundamental characteristic that differentiates private schools, which are run by non-state organizations, and public schools, which are run by the government.
So are these predicated on financial autonomy?
It's many different levels of autonomy. Yes, financial autonomy is a huge part of that, because he who pays the piper dictates the tune. And there is a lot of evidence to suggest that where the decision maker, the power, the decision of the decision maker has far-reaching implications for the organization that decision maker has decisions for or makes decisions for. And what that simply means is that when we break it down to school level, who is the decision maker or who is the financial provider for a private school, for example? It's the parents, and so they make the decisions, So that's why the PTAs are so powerful, because the parents are the ones that we don't want this, we want that. No, actually, let them stay on for extension classes, okay? Let them stay until 5 if they need to stay on for extension classes. In the public schools, there's more regulation, there's a sense of equality, so sameness. And the decision makers are not as close to the school level in that sense. The decision makers tend to be the policy makers in the state ministry or the federal ministry, and it's what they say or what they put forward as important that will be done in the schools. So that's a fundamental difference between public and private schools. So autonomy, yes, and which is why today we're seeing that a lot of non-state schools, are going ahead. They're buying the chlorinated water, they're buying their they're not waiting for the government doesn't have responsibility toward them, so they're not waiting for the government. They're going ahead, they're purchasing these items, they're getting themselves ready for schools. Also because it's important for them. They need to pay their teachers' salaries. Where are they going to get the funds to pay the teachers' salaries? So we have to consider all of these things when we look at the difference between public and private schools. And at the end of the day, yes, autonomy has been proven to have an impact on school quality and on the learning outcomes of children, yes.
But looking more, looking at sustainability and looking at the long term, a lot of people believe that this has provided us with the opportunity to improve public hygiene. As you rightly observed, water has come from nowhere. Sanitizers are appearing, soap is appearing, and even in public toilets. How do we ensure that this is sustainable? Yes, the battle now is about Ebola virus disease and checking it, but ensuring that the measures that will be put in place ultimately will be sustainable for the long run, so that it's not just Ebola for now, but whatever else might come in the future.
I think that's an excellent point. And I think that this unfortunate situation presents an amazing opportunity for us as a country to improve on our personal hygiene. And so last week, I had the privilege of attending, some schools' emergency PTA meetings. And, for the first time perhaps ever, I saw the administrators of schools educating parents on how to ensure that the children, maintain high levels of personal hygiene, going down into very specific details. And it was very enlightening for those parents. I think that is fantastic. And I think that if that can be programmed into the calendar of the school, if that can be integrated with the curriculum of the school, whether it's a public school or a private school, I think it'll go a long way in making us a more hygienic nation. So I think that's an excellent point, actually.
Well, I reckon that you have had several talks, different schools, different policymakers about improving standard of education in the country. What kind of response do you get if you've spoken to anyone about it?
I think it totally depends on who you speak with and what you refer to as standards, because standards vary so much, the definition of standards varies so much. But the one thing I think we can all agree on is that learning outcomes represent a very good measure of standards, or how well children are actually doing academically. Of course, there are other measures as well, but I think that learning outcomes cannot be contested. That is a good measure of quality. I find that there is there seems to be this phenomenal will for something to be done in the private sector. The last Nigeria Economic Summit was focused on education, and the consensus at that event was that we really have a lot to do in the education sector, and it's not going to be done by the private sector alone. The government has a share, and the government understands that it has incredible amount of responsibility, and what we need to do going forward is perhaps find ways by which the public and the private sectors can cooperate to identify areas of priority. And so, because again, Nigeria is a federation, states have a lot of autonomy. What tends to happen is that states then go down to their own, or state governments go back into their own states, and they factor these things into their education sector plans. And then they put in place monitoring and evaluation strategies to ensure that what they have decided to do or decided to focus on in those plans is actually carried out. And I've observed that there are actually a lot of states who are very quietly forging ahead with some of these very good practice, examples of good practice. They're just forging ahead, they're doing what they need to do, and they're beginning to see the results in learning outcomes. It's a slow process, very painful, very slow, but it's steady.
Monitoring and evaluation these are two key words that can actually help, especially the public schools. And usually they are doing it in a subtle way, and we're getting to see results, right? What else can they do that we can actually feel the way you spoke eloquently about the private sectors, about the private schools and the public schools? What can they latch onto now?
I think, and I sincerely beg your pardon for this, but I think that the realization for people in the education sector is that in a sector like education, whilst it's good to have tactical plans, education must be a strategic endeavor. And that's why it's really painful when you see a government on an excellent trajectory and then a new administration comes in, maybe from another party, and scuttles all of that and begins again. It's very, very painful because we've lost so much. So what is really, really important is that we look at the strategic focus of education, whether it's at the state level or at the federal level. That is what is important. And those strategic goals and the strategic objectives can then be broken down into more short-term or medium-term activities that can be carried out and easily monitored and easily evaluated. But I think that what perhaps is severely lacking is the will to commit to a level of continuity when it comes to policy formulation and policy implementation in the education sector. And if we saw that, if we saw just that will to continue, it would be phenomenal.
All right, that's all we had to let it go today. Thank you for coming on. Dr. Modupe Adefeso-Olateju is the Managing Director, Education Partnership Center. Well, she also sits on the board of the Commonwealth Youth Exchange Council in London. Thank you for coming on this morning.
Thank you so much for having me. It's such a great pleasure.
All right, and we'll be back after this break. We've got sports coming up in just a moment. Join us again.